tell me a little bit about why you're here. Well, you do have severe perio for sure.
Yes.
There is generalized bone loss in all areas,
Right.
some worse than others.
Mhm.
You know, as an elective procedure, you could have the teeth extracted.
Mhm.
And then what we would do is put 4 implants on the top, 4 on the bottom, and then make you a fixed prosthesis made out of zirconia.
Right.
And you're done. It's one and done.
Right.
That's an option. The other option would be for you to address the individual issues, the teeth that are most loose, and then take it out, put an implant. But then, like you said, then it starts,
Snowballing.
it's snowballing. It would be a snowballing effect. So that's kind of where I see you. You're kind of in the middle of both options. The question is, what's going to make you happy? What's going to give you the best results? Do what we call the all-on-4 procedure.
Mhm.
Okay, yes, it is elective. You will have, your teeth removed, but we would place implants immediately. The next day, you would have a full set of teeth. 24 hours will get you temporary teeth. Okay, and then you would wear that for about 4 months. Then we do your final. We pick the color, we pick everything. Sometimes patients want these procedures, but they don't have enough bone. So in your case, you have a good amount of bone because that's where it holds the implants in place.
What would you do?
I mean, it's a good option. It's a good option because you're transitioning into, you're getting older. The teeth are becoming looser. The infection is not going away, and it's not a bad procedure.
They can send me through.
I mean, we already removed most of the cavities, but now we're filling this one back here. Okay, let's rinse. Yeah, we're doing good. Open base. Okay. So this one is very close to the nerve, okay? You may or may not need a root canal on it. Because once it gets to the nerve, that's it. Just put the line one more time. He had a very big cavity, very close to the nerve. We wouldn't have done this when it got to the nerve. There's still a possibility that he may need a root canal on this tooth. But we're able to clean the cavity out, put a base liner near the nerve to help remineralize the dentin. And now we're going to bond it. This is, what shade is this? What shade? A3. Okay. So he has a chipped implant crown. That's what we're going to fix. So what we're going to do is cut the porcelain, which has the fractured crown on it. Very good. Don't problem. Go ahead and give me a section. Right down here. Alright, so let's scan that really good so that we get something that looks pretty similar. This is what he has now, so that doesn't mean we have to pick the same color. Maybe something a little nicer. So now she's gonna scan that, okay?
Okay.
And we'll pick a shade together. Yeah. Pleasure to meet you. I'm Dr. Cabanzon.
Nice
Welcome.
to meet you as well. I just want to kind of get
Let me see.
my smile back to what it was
Of course.
2 months ago.
And crown number 9. And then number 10, we're gonna do a crown right down there. Number 20, she's gonna need a implant there as well. Implant and crown. Number 21 actually. So we would place the implants and typically within 3 months. We
Okay.
can make you a retainer, an Essex retainer
Mhm.
that you could have as a temporary
Like a
tooth.
prosthetic?
Yeah.
Okay.
It's like a retainer with a tooth.
Oh, okay. Like
Yeah.
a flipper.
I mean, a flipper, you take out the whole thing. This one is like a retainer. You put it on, it's clear, and then it has one tooth.
Yes,
It
yes,
probably
yes.
fits better. It doesn't like move so much.
Okay. Okay.
Yeah, so we'll do that one first, and then we'll get you back to do a full examination
Mhm.
to check for cavities and cleaning and all that other stuff.
Okay.
Okay? We'll scan you today.
Okay.
We'll make the Essex retainer so you could have it as soon as possible.
Okay.
And then that way, when we do the surgery and all that, you'll still have something as a temporary.
We got it.
¿Sonríe más?
Mhm.
Mamá. Okay. Así como luce.
Okay.
Como le digo, normalmente el borde, lo que es el borde de los dientes de arriba, caen sobre el labio de abajo.
Okay.
O sea, eso es lo ideal. Cuando ella sonríe, sonríe.
Mhm.
Ese borde tiene que caer sobre el labio de abajo. Es lo natural. Las mujeres enseñan más dientes que los hombres
Okay.
cuando sonríen. So, ellos tratan de hacerlo idealmente como eso. La forma natural es que los dientes vayan por encima. Para que puedas morder una manzana, puedas morder cualquier cosa. O sea, ellos posicionan los dientes, o sea, digitalmente en la mejor forma posible y en la forma ideal.